couple of years ago, when I was attending the TED conference in Long Beach, I met with the future of health. Well, from low-cost gene analysis to the ability to do powerful bioinformatics to the connection of the internet and social networking. Already today, you don't need to go to visit your physician in many cases. Only about 20% of actual visits do you need to lay hands on the patient. We're now in the era of virtual visits, from sort of the Skype-type visits you can do with American Well to Cisco that's developed a very complex health presence system. The ability to interact with your healthcare provider is different. These are being augmented by a whole suite of tools actually in the home now. So imagine we already have wireless scales. You can step on the scale, you can tweet your way to your friends, and they can keep you in line. Wireless blood pressure cuffs. So instead of wearing these kludgy devices, we can put on a simple patch. This is developed by colleagues at Stanford called the iRhythm. Completely supplants the prior technology at a much lower price point with much more effectivity. Now, we're also in the era today of quantified self. Consumers now can buy basically $100 devices like this little Fitbit. I can measure my steps, my caloric outtake. I can get insight to that on a daily basis. I can share that with my friends, with my physician. There's watches coming out that'll measure your heart rate, the Zio sleep monitors. And as we start to integrate this information, we're going to know better what to do with it and how better to have insight into our own pathologies, health, and wellness. There's even mirrors today that can pick up your pulse rate, and I would argue in the future we'll have wearable devices in our clothes monitoring ourselves 24/7, and just like we have the OnStar system in cars, your red light might go on. It won't say check engine light, it's going to be check your body light and go in and get taken care of. And probably in a few years we'll check into your mirror and it's going to be diagnosing you. Okay? For those of you with kiddos at home, how would you like to have the wireless diaper that supports your... Too much information, I think, than you might need, but it's going to be here. Now, we've talked about augmenting the patient to some degree. How about augmenting the physician? We're now in the era of super enabling the surgeon, who can now go inside the body and do things with robotic surgery. And now this is being augmented with further layers of technology, like augmented reality. So the surgeon can see inside the patient through their lens where the tumor is, where the blood vessels are. This can be integrated with decision support. A surgeon in New York can be helping a surgeon in Amsterdam, for example. And we're entering an era of really truly scarless surgery called NOTES, where the endoscope, the robotic endoscope, can come out the stomach and pull out that gallbladder all in a scarless way and robotically. And this is called NOTES, and this is coming. Basically, scarless surgery is mediated by robotic surgery. Now, how about controlling other elements? For those who have disabilities, the paraplegic, there's the era of brain-computer interface, or BCI, where chips have been put on the motor cortex of completely quadriplegic patients, and they can control a cursor, or a wheelchair, or potentially a robotic arm. Imagine when we can connect these, for example, to the amazing bionic limbs, such as those of the DECA arm, built by Dean Kamen and colleagues, which has 17 degrees of motion and freedom, and can allow the person who's lost a limb to have much higher levels of dexterity or control than they've had in the past. So we're really entering the era of wearable robotics, actually. If you haven't lost a limb, you've had a stroke, for example, you can wear these augmented limbs, or if you're a paraplegic, like I visited the folks at Berkeley Bionics, they've developed the e-legs. I took this video last week. Here's a paraplegic patient actually walking by strapping on these exoskeletons. And now this is the era of wearable robotics. And I think by leveraging these sorts of technologies, we're going to change the definition of disability to, in some cases, be superability. Now, the obesity trend is exponentially going in the wrong direction, including with huge costs. But the trend in medicine actually is to get exponentially smaller. So a few examples. We're now in the era of Fantastic Voyage, the iPill. You can swallow this completely integrated device. It can take pictures of your GI system, help diagnose and treat as it moves through your GI tract. We're getting to even smaller micro robots that will eventually autonomously move through your system again and be able to do things that surgeons can't do in a much less invasive manner. Artificial retinas, the ability to put these arrays on the back of the eyeball and allow the blind to see. Or for those of us who are sighted, how about having the assisted living contact lens? Bluetooth, Wi-Fi available, beams back images to your eye. Now, if you have trouble maintaining your diet, it might help to have some extra imagery to remind you how many calories are going to be coming at you. If we go down the small pathway a little bit further, we're entering the era of nanomedicine, the ability to make devices super small to the point where we can design red blood cells or micro robots that will monitor our blood system or immune system, or even those that might even clear out the clots from our arteries. Now, how about exponentially cheaper? In genomics now, the genome cost about $1 billion about 10 years ago when the first one came out. We're now approaching about a $100 genome. What are we going to do with $100 genomes? And soon we'll have millions of these tests available. And that's when it gets interesting, when we start to crowdsource that information and we enter the era of true personalized medicine, the right drug for the right person at the right time, instead of what we're doing today, which is essentially the same drug for everybody, sort of blockbuster drug medications, in many cases which don't work for you, the individual. And many, many different companies are working on leveraging these approaches. And I'll just show you a simple example from 23andMe again. My data indicates that I've got about average risk for developing macular degeneration, a kind of blindness. But if I take that same data, upload it to DecodeMe, I can look at my risk, for example, type 2 diabetes. I'm at almost twice the risk for type 2 diabetes. I might want to watch how much dessert I have at the lunch break, for example. It might change my behavior. So again, it's not just genes, it's multiple details. Our habits, where you live, what you've been exposed to can dramatically affect your health. We can capture that information. So genomics, proteomics, the environment, all this data streaming at us individually and as us as poor physicians, how do we manage it? Well, we're now entering the era of systems medicine or systems biology, where we can start to integrate all this information, and by looking at the patterns, for example, in our blood of 10,000 biomarkers at a single test, we can start to look for these little patterns and detect disease at a much earlier stage. And this is being called, by Lee Hood, the father of the field, P4 medicine. We're going to be predictive. We're going to know what you're likely to have. We can be preventative. That prevention can be personalized. And more importantly, it's going to become increasingly participatory through websites like Patients Like Me, or managing your data on a Microsoft Health Vault or a Google Health. Leveraging this together in participatory ways is going to become increasingly important. Exponentially better. We'd like to get therapies better and more effective. Now, today we treat high blood pressure mostly with pills. What if we take a new device and knock out the nerve vessels that help mediate blood pressure, and in a single therapy basically cure hypertension? This is a new device that essentially is doing that. How about more targeted therapies for cancer? Right? I'm an oncologist, and I know today most of what we give is essentially poison. We've learned at Stanford and other places that we can discover cancer stem cells, the ones that seem to be really responsible for disease relapse. So if you think of cancer as a weed, we often can whack the weed away. It seems to shrink, but it often comes back. So we're attacking the wrong target. The cancer stem cells remain, and the tumor can return months or years later. We're now learning to identify the cancer stem cells and identify those as targets and go for the long-term cure. And we're entering the era of personalized oncology, the ability to leverage all this data together, analyze the tumor, and come up with a real specific cocktail for the individual patient. Now, I'll close with regenerative medicine. So I've studied a lot about stem cells. Embryonic stem cells are particularly powerful. We also have adult stem cells throughout our body. We use those in my field of bone marrow transplantation. Geron just last year started the first trial using human embryonic stem cells to treat spinal cord injury. Still a phase 1 trial, but evolving. We've been actually using adult stem cells now in clinical trials for about 15 years to approach a whole range of topics, particularly in treating cardiovascular disease. If we take our own bone marrow cells and treat a patient with a heart attack, we can see much improved heart function and actually better survival using our own bone marrow-derived cells after a heart attack. But where is stem cell therapy really going? If you think about it, every cell in your body has the same DNA as you had when you were an embryo. We can now reprogram your skin cells to actually act like a pluripotent embryonic stem cell and utilize those potentially to treat multiple organs in that same patient, making your own personalized stem cell lines. And I think there'll be a new era of your own stem cell banking to have in the freezer your own cardiac cells, myocytes, neural cells, to use them in the future should you need them. In close, as you think about technology trends and how to impact health and medicine, we're entering an era of miniaturization, decentralization, and personalization. And I think by pulling these things together, we can start to think about how to understand and leverage these. We're going to empower the patient, enable the doctor, enhance wellness, and begin to cure the well before they get sick. Because I know as a doctor, if someone comes to me with stage 1 disease, I'm thrilled. We can often cure them, but often it's too late and it's stage 3 or 4 cancer, for example. So by leveraging these technologies together, I think we'll enter a new era that I like to call stage 0 medicine. And as a cancer doctor, I'm looking forward to being out of a job. Thanks very much.
Thank you. Thank you.